we will start with our practical examples on research ethics and administration landscape in Cameroon. So this presentation is an overview because in the next one, we will see something more concrete. Then this is the outline of our presentation. We will introduce research ethics committees, the types of research ethics, the law governing medical research in Cameroon, administrative authorization, the specific reforms, and conclude with our presentation. The objective of this presentation is to provide a basic information of the Ethics Committee and administrative procedures in Cameroon. This will be done specifically by defining what Ethics Committee is, to give the types of ethics committees and their competencies, and to provide the administrative authorization procedures in the specific context of Cameroon. As an introduction, in research, medical and public health research, ensuring study participants' protection, safety, and well-being are paramount. So an independent and comprehensive ethical review is necessary. Now, the ethics committee also has many names. We can have ethics review boards, independent ethics committees, institutional review boards, and research ethics committees directly. This is what we mostly use here in Cameroon. Research ethics committee in most of the Francophone countries is Comité d'éthique indépendant, independent ethics committee, and Anglo-Saxons in institutional review board, especially linked to the institutions. But all of these committees, they are still ethics committees and they have one important role. They operate as the guardian of human rights, safety, and well-being in the context of medical and health research. Research ethics committee, so finally, what is it? First of all, it is an independent body. You can see some word will be highlighted according to the sentences where you have to pay particular attention. So the first thing you should note is that it is independent. It is constituted of medical, scientific, and non-scientific members. So you can see that it is made up of different members from different fields. It applies research ethics by the review, approval, and monitoring of research ethics protocol involving human beings, with the purpose of verifying that such protocols submitted to them comply with ethical rules. We have seen all the ethical rules, the Benmont Report, the Helsinki Declaration, the Nuremberg Code, the different laws, and to protect the rights, safety, and welfare of research participants, and to ensure that the methods proposed for research are ethical. So we are seeing that it should look if the ethical rules, where the research is ethical, everything should really, after review, approval, and monitoring research protocols involving human beings, the final most important objective is the protection of the rights, safety, and welfare of participants. After defining what is its mission, to review, we have seen it in its definition, approve and monitor the pertinence of research protocols, to ensure that these protocols comply with ethical, but not just ethical, but even scientific rules, to ensure that all research activities are carried out transparently with reporting, to assess the aptitude of investigators to handle projects. That is why the investigator should always give the CV, to report any irregularities leading to the interruption of the project, to ensure the fair dissemination of the results to the participants and regulatory bodies, and the most important mission that we are seeing from the definition till now, to safeguard the dignity, right, and safety of all the research participants that will be part of the study. Apart from its mission, who are the members? According to GCP, IRBs should be made up of at least 5 members, minimum. There should be a scientist, a non-scientist, and at least a member not affiliated to the IRB supporting institution. Here in Cameroon, the ethics committee is made up of physicians coming from the order of physicians, the order of pharmacists, and the order of dental surgeons. So these are already 3 members here. We have experts representing the order of medical and health professionals. These are for other paramedical associations. We have experts representing state medical facilities. experts representing the Association of Patients. We have now experts in health law, in civil society, and even religious confessions. We have experts in ethical and scientific evaluation. We have experts from traditional practitioners. So what there should be one traditional practitioner in the research in the ethics committee and one representing the research institutes in medicinal plants. And finally, experts representing ministries. This is the Ministry of Scientific Research, the Ministry of Public Health, and the Ministry of Higher Education. The mandates of the Research Ethics Committee in Cameroon are according to the National, Regional, and Institutional. So type of Research Ethics Committee, the regular members, the substitute members, the mandates, and the number of renewals they can have on their mandates, and the sessions the Research Ethics Committee has. So in Cameroon, these are the type of Research Ethics Committee. We have the National Ethics Committee of Research for Human Health. We have regional ethics committees, the Central Regional Ethics Committee, the South, the Littoral, the West, the Northwest, the North, the Far North, and the Southwest Regional, the Cameroon Bioethics Initiative, which is an independent review board not attached to any institution. And finally, we have the institutional ethics committees, where we can, as an example, the Cameroon Baptist Convention, RRB, the Faculty of Medicine in Yaoundé, same with the Faculty of Health Sciences in Boya, the Dual General Hospital, Yaoundé Central Hospital, Yaoundé General Hospital, Bamenda Regional Hospital, the Chantal Biya International Reference Center, and even the Research Foundation in Tropical Disease and Environment. So this means that these institutions are already equipped with your own institutional ethics committee, where if you want to perform a study in their respective institution, you need to have their ethical clearance. What are the competencies of the Research Ethics Committee? Let's start with the national. The jurisdiction is the whole country. So when you have the ethics committee, ethical clearance from the National Ethics Committee, you have ethical clearance that makes your study to be ethically valid in the whole country where you are doing your study. So the authority is the Ministry of Public Health. You have seen that Kambina is said not attached. Meanwhile, we said ethics committees are independent. This is because these are supporting authorities. They support you to help you in your different interactions with the population and their researchers. A study to be eligible for the national ethics. One, if your project is covering the entire country or two or more regions. If your project is initiated by a promoter that will be implemented in another institution, either in the same region or different region. So make note to this condition, you will see it again. Projects in regions without the regional ethics committee, clinical trials, no matter the region, have to pass through the National Ethics Committee. Projects involving material transfer agreements out of a country, projects involving international collaborations, projects across several institutions in different regions, high-risk studies and pilot intervention studies, and finally, projects with external funding. So all these projects are eligible to be reviewed by the national ethics. What about the regional? The regional, your project should be located entirely within your region of jurisdiction, and the project initiated by a promoter that will be implemented in another institution of the same region. You can see that this sentence cuts here, in another institution of the same region. Meanwhile, here we said another institution of the same region or different region. So all projects that goes to the regional ethics can also be part of the national ethics. It depends on you. And finally, institutional ethics committee, the jurisdiction is the institution where you are taking them, and their authority is still their institution. The institution can be a health institution, academic like universities, health like hospitals, and research institutions like CBC. So projects conducted entirely within the institution, projects where the research participants are only recruited within that institution, projects that require human and material resources from the institution and studies with no external funding. Yeah, same with regional studies. Now, these are new laws here. From 2022 to 2024, we had some new reforms, where the first one was the law relative to medical research involving human subjects in Cameroon on the 27th of April. So we had the general provisions and guiding principles. We even had particular principles, provision for vulnerable populations. We have rules on the conservation of biological material and health-related data, roles of the investigator and promoter, specific provisions applicable to clinical trials. We have the sanctions and final provisions. Apart from that, we also had on the on July 2022 the one related to medically assisted procreation. So persons who are the persons benefiting from it, assisted reproduction centers, so that you should not go to one center that's not accredited by the government, the relationship between beneficiaries and the assisted reproduction center, human reproductive material that will be used, the effect of medically assisted procreation on filiation and children, prohibition, sanction, and final provision. And finally, recently on the 23rd of December 2024, we had the new law on the protection of data. No. So now if you need something, you will not now go to the Ministry of Communication or Telecommunication on particular data, but there's now a law relative to all human protection here in Cameroon, the legal regime governing the processing of the personal data, the right of the data subject, the prohibitions, the personal data protection authorities, penalties, and final provisions. Now, we are looking at the laws governing medical research in Cameroon. We look at the titles, but what is it mostly talking about? It covers traditional or alternative medicine studies in human and social sciences. You see that this traditional will always come. Traditional healers, traditional studies is now something that is integrated to our ethics committees and research ethics in Cameroon. We have the safeguarding of the rights of livings and even deceased individuals. We have the highlights. It highlights the accountability of researchers and research project promoters. It provides protection for the use of biological materials and personal data. It enforces the necessity of written informed consent from study participants. It stresses collaborative partnership and consequences for infringement. We have seen it everything from our first presentation due to the misconduct of different researchers. And it emphasizes the respect for human dignity, including vulnerable population. All these different titles and items are intercorrelated. You cannot cover traditional medicine without providing protection, without emphasizing the dignity of vulnerable people, without stressing on collaborative partnership, enforcing the necessity of written consent, accountability of the researchers. You can see everything is interconnected together. But apart from that, these are some penalties, especially on section 62, disclosing confidential data without prior consent. This of confidentiality is really important because no matter the law, it is always coming. Penalties on disclosure without prior consent from the person having the data. So the penalties, what are they? You will be in prison from 3 months to 3 years, a fine from 20,000 to 100,000 CFA francs, which is even relatively small, but it's okay, and professional sanctions, such especially for the in medical fields, such as suspension or even removal from the medical register. Now, we have seen the research ethics and how it functions here. What about the administrative authorization of research? You should first of all note that the protection of research participants in Cameroon is under 4 main actors. First of all, the institution hosting the research project, and he accepts by giving the approval letters. Secondly, the PI, the sponsor, and the research team, and they show commitment through validated protocols and standard operating procedures. Thirdly, what we have seen, the competent research ethics committee who gives approval through the ethical clearance. And finally, why we are having this slide on administrative authorization is because in Cameroon, the fourth actor is the Ministry of Public Health through administrative authorization. So the administrative authorization of research, you can also see ARA, Administrative Research Authorization. It is complementary to the ethical clearance. So when you have it, it is because you are adding value to the ethical clearance you obtain for the security and protection of participants during the implementation of your project. So before you submit your project for an AER application, ensure that you have ethical clearance. That is the first thing. And secondly, ensure that you have approval letters from the institution. So both are always to be for the ethical committee to ensure your protocol for the ethics clearance, ethical committee. You have to ensure a good protocol. You have to ensure approval letters. And now to go to the administrative authorization of research, don't forget that the approval letters are still important, and ethical clearance now is to be added. The AAR application is processed within a period of 21 working days at the Division of Health Operation Research from the Ministry of Public Health. So you have 21 working days when you have to send it. Here you will only submit one physical copy of your protocol and no fee is required. So there is no fee for protocol evaluation at the Ministry of Public Health for administrative authorization. And finally, the structure of the protocol here for AAR is different from the one submitted to the national ethics. So we will see all the different structures in our presentation 3.3 on ethics review processes. After that, to obtain your administrative authorization of research from the Ministry of Public Health, you should note that four main criteria are evaluated. First of all, they check if the application is complete. They're asking for A, B, C, D, and have you submitted everything? Okay, you have passed the first mark. The second one is to verify the competence of the Research Ethics Committee that issued the ethical clearance. Is it recognized by the Ministry of Public Health? Is it an institution that has been newly created and the institutional review board is not yet accredited or accepted? So they see if it is really valid, your research ethics, your ethical clearance. They verify now the competence of the institutions implementing the research project. So is the institution used to have research? Is it an institution that is already accepted from the different ministries and in Cameroon? And finally, they verify if the protocol you submitted to the Ministry of Public Health is consistent with the one submitted to the National Ethics. So amendments, if you have amendments, first of all, obtain the ethical clearance from the amendments before submitting, because you cannot submit to the national ethics with three specific objectives and you come for administrative authorization and now you have four. So where is it coming from? Note that the administrative authorization of research, that is the trust, is not far from the national ethics. So they are interchanging and communicating every day to verify if the protocols are really consistent. Now, why do you need administrative authorization? We said it is complementary, but apart from its complementarity, the advantages, first of all, for the authorities is to ensure the traceability and visibility of research. It is to provide reassurance that the research protocol is being strictly adhered to. You see, it's not assurance, reassurance, because you already obtain ethical clearance, you obtain even approval letters from the institutions. It is to provide access to data on the research carried out and related to results to be used for decision-making and public policies. Because when you submit your protocol to the ministry, you write a letter that at the end of the study, you will give their report to them. So you are already an act of honor of what you will do with the data. That is why it provides this access already. Now, for the researchers, it facilitates the researchers access to the study site. You come, you have ethical clearance, you have administration authorization from the ministry. That is already okay. It gives your work credibility and even your results for the research and the researcher. And finally, the participants, it gives confidence that the research that you are carried out is authorized and monitored. So it's not just authorized by an by the ethics committee, but also by the Ministry of Public Health. Now, what are the specific reforms that happen here in Cameroon? First of all, In 1987, we had the order number 079 related to the creation and organization of the Cameroon National Ethics Committee for Research in Human Health to regulate studies. So, according to others, and according to our reforms, the first ethics committee was created in Cameroon in 1987. After that, in 2009, we have specific reforms regarding administrative authorization of research, where decision number 0689 on the 29th of July on the conditions for issuing the administrative authorization of research in human health in Cameroon organizes the administrative assessment of research protocols prior to their implementation. And this decision states that only the Ministry of Public Health is capable of issuing administrative authorization of research. But unfortunately, after that, studies were still being conducted without it. So in 2010, we had a circular letter from the Ministry of Public Health on the 7th of June regarding academic research where academic studies do not necessarily require administrative authorization of research. If they have approval letters and if they have ethical clearances, it is okay. But no, after 2009, 2 years later, they found that many studies were still conducted without AAR. So they wrote again a circular letter on February 2011 on implementing operational health research in Cameroon and the highest importance of obtaining an administrative authorization of research. And since that time, now all the international studies should always obtain an administrative authorization. So after saying that in 2009 and coming back again in 2011, you will not say that you are not aware of having the importance of obtaining your AAR for your international or national study. And you can see that academic can are not obliged to have it. Now, ethics committee, a new order came out in 2012, number 0977, on the 18th of April on the creation, organization, and functioning of Research Ethics Committee for Human Health within the structures of the Ministry in charge of public health. What is highlighted in red is that one of the articles of this order counsels the 1987 order. So what are we saying here? That the Ethics Committee was created in 1987, but it became truly functional in 2012. So you see a little bit the difference between the 1987 and 2012. Later on, we have regional ethics committees from 2012 up to date. We had the creation of the first two regional ethics committees in Cameroon, the Central and the South. And later on, in 2021, the West and Littoral Ethics Committee were created. In 2022, the Northwest and North Regional Ethics Committee. And 2023 to 2024, the Southwest and Far North Regional Ethics Committee. Now we have 8 ethics committees out of 10. 8 regions now have ethics committees. So this is already a big movement in the changes. And finally, some new laws that we have seen already. The law of the 27th of April 2022 on medical research, on the 14th of April, 14th of July on medically assisted reproduction, and the end of year 23rd of December 2024 on personal data protection. So you can see that many things change in just like in 15 years from 2009 up to date, where different decisions, administrative authorizations, and ethics regulations have been used and have been written in order to reinforce research ethics in Cameroon. With the sound understanding of ethics review boards that we have seen the types, we have seen the competencies, we have seen the mandates, we have seen when they are sitting, the administrative authorization, how the protocol should, the different conditions on protocol submission, and the regulating laws, even with their penalties here in Cameroon. Researchers can embark on their studies with increased knowledge, assurance, and commitment to ethical and administrative practices. So you already know where are the regions where regional ethics committees are located, the conditions to fulfill, submit your protocol there, and what has to be done in order to maintain and respect the privacy, the anonymity, and the confidentiality of participants. So these were the references used, and thank you for your keen attention.